And good afternoon. Super excited to be here today. For those of you guys that are coming here for the first time, again, my name is Alfred Ojukwu. I am a Microsoft hardware specialist, specifically on Surface, and I'm super excited to be here with my great friend.
I'm Val Fallon. How's it going?
I'm super excited, and I know this is another episode of the Surface podcast series, and we've got some pretty exciting stuff to share with you today. We've done a lot of work in a lot of our hardware, and we've got a pretty cool device that I think if any of you guys had it today, you'd be more than ecstatic. So our discussion today is going to take a little bit of a curve and talk about this specific device because it's something that I'm passionate about, and I know Valen and her team are passionate about too. So I'm going to ask Valen, which device is it, Valen?
It's the Surface Duo 2. Was just released. Yep, very excited about it. If you haven't seen the first one, oh man, you are going to love the second version.
Exactly. And then we spent a lot of time with some of these newer hardware, and what we've done is basically do a good job of redesigning the platform and coming up with ways to be more efficient in what we do. So what you'll see here in the design is a number of different devices that have essentially changed the game. A good example of that, my screen is we've done a lot of work with, the hinges and making sure we had great performance, even to the point where when you look at the device, you can see the actual components on it. And this Surface Duo 2 is quite slick. I mean, honestly, I think it's something that is probably going to change the industry to some degree. Now, of course, across the board, these are all the devices we have. If you haven't had a chance to try any of these Surface devices, please do. The one we're going to be talking about is this bad boy right here, right? So I won't be able to circle it, but you guys can see what I'm talking about. So can you tell us a little bit about the Duo 2, Val?
Yeah, so with the Duo 2, it's 8.1-inch diagonally across, still with the same pixel sans, beautiful screen. You can launch two applications at the same time. And if you guys didn't know, this is based on Android platform on the 11th OS gen. So it is super fast, 8 gigs of RAM. So what makes the difference this time is there's 3 cameras on the back side, 16 megapixel ultra wide. And then you have the front is 12 megapixel camera with low light detection. Oh, Alfred, this is such a beautiful device. I can't wait to get my hands on it.
Me too. I've got the Duo 1, and I'll tell you what, that Duo 1 is definitely a sight for sore eyes, but I think we've done a lot of work with identifying ways to enhance the overall performance. Little things like being able to provide NFC readers into it, right? I believe that's something we added on there. Another thing that I think is pretty cool is now that we have the ability to use 5G, these devices are made for 5G. It's great. Better performance, better capabilities. You still have some of the basic features. We talk about drag and drop, easy to take notes. We spend a lot of time continuing to innovate on these sort of devices. That's why I'm so excited. The other thing that you'll notice about the device is that there are features that are enhancing it. Even what we call, we talked about the peek view, being able to open the device a little bit and look at it, but also, I always forget the name of this term. What is that called when you can actually see the
it's just got the preview. It's just on the bottom, as you can see the time, you can see what messages you've missed, what notifications have come up that you need to pay attention to. It's pretty slick without actually opening up the device.
Exactly. One other thing that you'll notice with these devices, it actually comes with a really, really cool pen, the Surface Pen 2, which has haptic touch built into it. What that means is when you're actually pressing against the screen or using it, it will give you some sort of feedback to let you know whether you're drawing something or writing something. That feedback is actually helpful for the end user who's actually using that pen. So imagine using that pen on a Surface Duo, or in fact, any Surface device. Lots of power there.
Yeah, and the fact that the pen was made to feel like writing on paper, that is really such a differentiator. So I've got one too, and I love using it.
Exactly. Yeah, I'm super excited. And again, we're sharing this with you guys because I think it matters in this space. And let's talk about some of the work you and I do. Val, we work in the provider space, the payer space, and I'm sure that a device like this may come in useful in the healthcare space. And you want to kind of maybe share a little bit about what you're seeing in the industry as it pertains to this?
Yeah, so, number one is the form factor, being able to fit into a clinician's pocket. That is so key because if you have a device that's so big, you have to hang on to it, you can't put it down. The other thing is it's a cell phone. It's capable of doing eSIM. You can put Teams phone on it, so you can have corporate versus putting your own personal SIM card in that if you want to. It's so versatile. A few of our clinicians that I work with have actually deployed our Duo, the first generation. So think of Epic just made for iOS and Android. However, more favorable on the iOS. But now imagine if the clinician says, well, there's a lot of restrictions with the mobile platform. I prefer to be at my desktop because, I could get more of a bigger view. But using Citrix to tunnel into the whole experience is much, much better. So it's one of the videos we're going to share with you in a moment will show you how well it's done with a clinician.
No, I agree. And I think that was one of the amazing things I saw. I think you pulled me in on one of those calls with one of the doctors. I mean, you could tell how elated he was because what he was able to see with the solution is it actually helped him and his team be more productive. Think about being able to reduce the number of devices from 3 to 1.
Right.
You've got a phone device, you've got a capability of taking in entries for information, and as well as a way to check your mail. As before, you'd have a mobile device, you'd have a laptop that you basically use to check your mail, and you had maybe a device that you could take doctor or clinician calls. By combining that into a single device and being able to put it in your pocket, it tells a completely different story.
Yeah.
And Val, you and I know home and healthcare, especially where things are today, has become very, very much an important part of the provider and delivery space when it comes to healthcare. Um, I can see this becoming something that people take advantage of, wouldn't you say?
Oh, absolutely. This is game changing for sure. I've even got home health visiting nurses using it because they didn't want to carry a laptop bag that, perhaps is to an area that's, not safe. You can just have the device in your pocket. Very, very easy to conceal and use, and have the phone as well for calling. One of the things I do want to mention too is you don't have to just type on the keyboard or use a pen. You use Nuance to record anything that you want to input into the system, and it's very, very accurate. I can't wait to show it to you.
Yeah, you know what? I always say you don't have to take our words for it. We've got a video. Let's let the doctor, the good doctor, share with you what we have.
So let me talk you through, and do you want me, Val, just to go ahead and just jump right in and
Yeah, that'll be
show
great.
you the workflow? Okay,
Thank
great.
you.
So what I'm going to do is I've got my Duo, and I'm going to share the screen on the Duo. And what I'm going to do is I'm going to show you, I first access Citrix. And so here's the Citrix workspace, and I'm logging in. And you'll see here the top icon, or the top choice here, is your, and so it downloads an ICA file, and then it opens. Okay, and so here is where we're going to enter, and I'm going to click continue. And see here is you've got the beauty of the dual screen. So on the left, you see this is the full, okay, and it's not the dumbed down Android or iOS mini version. This is the full functionality of, and you see at the same time, I've got my, Android apps sitting here on the side window. And I'm going to show you later how that's really helpful for me to have the two applications together. But of course, on the Duo, the real magic is to be able to extend the Epic Hyperspace across both screens. So now you see I've got a full, and you can see here, it's like a full screen tablet, right? Yeah. And I can still zoom in. And so here's the, I'm going to look in the encounter list for this test patient. Here was the last note that was written. And you can see the labs and, other reports. And notice that I'm just, 2 fingers to zoom, so I can zoom and pan all the way through. Okay, and I'm accessing the full application. But now let me show you a little bit more magic. So if I flip the screen, so now I'm going into
nice
mode. Okay, now this is really cool, right? So you still see the full screen, and when I zoom in, now, I don't know if it's coming across on Teams, but this is completely readable. So because of the high resolution of the Duo screen, I can see this clearly, and it's basically like the whole view, right? Okay, so now let's say, what do I do about the keyboard? So in Citrix, you see at the very top, there's that little pull down at the very top of the screen. That actually is a touch menu where I can activate a keyboard. Okay, so you see that this keyboard is not the Duo keyboard. I believe it's the Citrix keyboard. But notice that on the device, the experience is now it's like a little keyboard at the bottom of the screen. And
so
look,
cool.
I've got like a little laptop, right?
Yeah.
And so now, so now combine this with the Slim Pen, right? So now I can go in here, and I'm actually going to start an encounter. And I'm going to say new, and I want to say after hours. So I'm typing on the little keyboard here. I'm starting a new encounter with the patient. And let's say I want to write a note. And so I can, create a note. And I can just type it right here. This is a note. So you can see the difference between this and using kind of the iOS and Android versions is that this is a full, read, write ability to get into the EHR. And again, it's like suddenly you've turned the Duo into a tiny little laptop, and it's really super cool that way. And anytime I'm not typing, of course, I can just extend, get rid of the keyboard, and now I'm back to, full screen mode this way. Okay, so now I'm going to show you one other trick, because now that you guys are owners of Nuance, I can show you Dragon as it works in here. Okay, so this is super cool. So what I'm going to do is, let's see how I do this. I am going to turn on Dragon. So this is Dragon playing inside Epic. I'm sorry, inside Citrix. Okay, the Citrix environment. So that is Dragon there. Now I'm going to show you. I've got.
So this is the Android version of Dragon, correct?
This is the Android version, right? And so in fact, I have it here. I'll log into Dragon here. There. Okay. So that is Dragon running in the bottom window, and here is running in the top window.
Oh,
okay.
wow.
So now watch. I'm going to start a note here. Okay, and you're going to see where this is going here. So, see this?
There we can see it.
The patient comes in for follow-up of cough for the last 3 months, period. It started when he went on a business trip to Las Vegas, and was sitting next to a patient who coughed into his face, period. The other person was not wearing a mask, period. The patient went home and immediately started vomiting and having seizures, period.
Okay.
And ever since then, he's worried that he has COVID, period.
You had me at hello.
That's awesome.
Okay, so you see,
wow, that's great.
Voice, and because it's Dragon, it's completely HIPAA compliant. You know, it's not Google Voice, it's not Siri. You know, unfortunately, it's not Cortana, and I think that's a question that I've been asking your colleagues, you know, in other divisions about, like, at some point, can we get Cortana to you know, play on this? But so this is full on the one side. Here's your Dragon on the other side. I had shown Val some of this earlier, but there's a super cool app called Complete Anatomy, and I don't know if you guys have seen this running. There's actually an Android and iOS version, and because I had bugged the company enough times, they actually now have a Windows 10 version of this. And what it is it's a anatomy 3D model that you can use to, you know, teach yourself, or very importantly with patients. And so when you're going through and demoing, you know, hey, you've got this broken bone, or this joint is the one that's not functioning well, you can actually open up the atlas and go right through your 3D model right here. And of course, just like, you know, everything else on the surface, you can blow it up and make it huge. And then here you are with your 3D model on the surface. And so, you know, so this device has so much, you know, potential here, because you just slip it right into, you know, this fits right in a coat pocket. You can't do that with an iPad. You know, I wish I could do that with my Surface Book, but the fact is that there's times that it's just very convenient to have, you know, the fully mobile. And especially, and I'll be honest, so it's not like every clinic, this is all I'm using. You know, really in clinic, what I'm using is my Surface Book 3, and even there, I usually use the top of the Surface Book 3 because I love the light, thin, big tablet. And then when I walk back to my desk, I plug it into the base, and then now I've got like the full keyboard experience. But what I do like the Surface for is when I'm on call and I'm at home, or I'm out, you know, running errands, or I'm between clinics. It's so convenient to just open this thing up, and you saw, you know, as long as I've got Wi-Fi, actually, even if I'm on my LTE, you know, I can connect into the service. So as long as I'm within cellular range somewhere, I can access the EHR, and it's fully, you know, locked down behind the Citrix firewall. So this is, you know, it's not like surfing the unsecured web. It's completely encrypted and locked down and safe for patient interactions. So, so Val, is that what you wanted me to show the team?
Yeah, no, that'd be great. And also, perhaps you're using the phone app, right? Your phone app.
That's what was my question. Yeah. Do you use it as a cell phone as well?
Oh yeah, that's the whole point. And
yeah.
So okay. So let me show you the
oh man, now
the on-call situation. So again, because of the way that Duo allows you to set up, you know, the you know, 2 apps at a time. So what I've set up is this one configuration, which I let's see here. So it's patients, and so what this is on one side it is the
wow.
It is the okay. Yeah, let me log into that. Okay, so and is the kind that runs on Android. Okay, so there's kind of like a patient list and so on. But on the other side is the Doximity dialer, and the I don't know if you understand or have heard what the Doximity dialer does, but essentially it is a legal spoofing program for doctors. And what that means is I can call the patient back, but
and they don't see
they don't see my phone number. Exactly. Right. So it actually sends the caller ID of my clinic. And so it looks like I'm calling from the clinic. And it encrypts, the voice over IP and so on. It also allows video calls. And so, what it does is it'll send an SMS message to the patient, and then they give consent, they turn on their webcam, and then you can have a video conference with them. But the point is that notice that while I'm talking to the patient on the phone, I've got Haiku open on the other window, and so I'm able to look into their record, without flipping back and forth, which has always been, on the traditional smartphones, just a big hassle because you're constantly having to flip back and forth, between the
call and the application. Right.
Exactly. And then, of course, if I'm on the road, I'll just flip it over, and then it's just like full, cell phone mode.
Right.
I love the voice quality of the speakerphone. I hope it's as good with the Duo 2. But actually, most of the time when I use it as a phone, I've got it on speakerphone. So that way, if I'm driving, I'm hands-free. If I'm in the office and nobody can hear, I'll do speakerphone. Very easy connectivity with Bluetooth. So if I want to, be more private, I can just Bluetooth it.
Yeah. So in the beginning, Dr. Ting, you were using it with your phone app to share the screen, right?
Okay. Oh, you were talking about your phone app, correct?
Yeah. But both questions was good. Yeah.
Yeah. And so, I thought you were asking, do I use it with my phone? I'm like, yes, I use it as a phone. Okay. So let me just pull that up. And
I think that's what we were seeing earlier, right? That was the phone app, which.
Well, so earlier I was actually using
one that they use, the spoof
screen
dial.
sharing. Yeah, and so this is.
Oh, really? What were you using earlier?
I was using Teams. Yeah, so this is the My Phone app.
Oh, okay.
You're right. Oh, it is super great on Teams, by the way. Okay, so this is, as you're seeing, this is the My Phone app. Now
so you could have made the same phone call. Sorry, I didn't mean to cut you off. But you could have essentially made the same phone call and not had the breakage between Epic and Teams, right? Could you do it with your phone app?
I can, with the caveat that it seems that the My Phone app masks out HIPAA apps. So for instance, if I go in here and try to open Doximity and Epic, look what happens. So it's just blank. Yeah, because like if you look at I don't know if you can see
security feature.
Right. So there's a kind of a HIPAA security feature, and I've noticed that other apps also get masked out. So let me show you. For instance, here's our Imprivata Cortex texting app. Okay, so on one side, it's my Secure ID RSA, and on the other side, it's Cortex. And when you try to do the My Phone sharing, it just blanks out the screen. You see that?
Well, My Phone supports security. That one you can put on the list. Support security works.
Yeah. So that actually, I totally understand that it's a feature. On the other hand, just like, with this call here, then it becomes useless for actually doing demos because it just blanks out the screen and I can't show you anything.
Yeah,
and then just go to Teams and then you're fine.
Exactly. So when you go to Teams, it's fine. And
because I think the difference is Teams is consented that you're going to be part of that meeting.
Correct.
So versus this isn't necessarily a consented, scenario.
Yes. And so, how I did it was I just went into Teams, I joined the meeting. Let's see, it was this one. And then I added it as a device so that it doesn't kick out the other device.
Other one.
Yeah. And then once I did that, then I could just do screen share. So, then I shared the screen.
Yep.
And then, okay, now we're probably like going way beyond what the design specs were on this thing. So.
No, it's working good.
Okay.
No, it works just like any other computer, right? I mean, the same, but better because it's far more features. Far more. So
Yeah.
this is
No, and I'll tell you, and you guys already know this. I mean, having the second screen is magical because you can actually be doing like monitoring this video conference and switching apps, in the next window. Like you actually can't easily do that and keep it all in your head, on a standard smartphone.
Mm-hmm. Mm-hmm.
wow.
That's good.
Very cool.
So a couple of questions, Dr. Ting. When you're using a tool like this, what would you say is the most beneficial feature in terms of how you were doing things before versus how you'd like to do things today? And you may have already stated it, but I just want to kind of talk about it from a practicality standpoint.
Yeah, it gets us, Alfred, a lot closer to a single device scenario. And what I mean is we've kind of gone in cycles to the point where for the average physician today, it's ridiculous how many devices we have to carry around, because typically you've got your personal cell phone, you've got your laptop, you've got your pager. So it's at least those three devices. And then in the case of what I do in my clinic, we also have a virtual scribe service, which uses a standalone Android tablet. And so I've got a tablet, I've got my Surface Book 3, I've got my personal cell phone, and I've got a pager. And it's like 4 different devices that you're walking around with all the time. And that's why I wear my white coat, because it's got all these big pockets, right? but the reality is when you move to a device like the Duo, now you start to compress. And so I showed you, I've got my secure messaging app on here. So that allows me to get rid of my beeper. I've got my, my secure phone dialer on here. So that gets, that takes the place of my standard phone. It's got Haiku, but then it's also got full Epic hyperspace. So that allows me to get rid of my laptop. And so basically I can replace 4 different devices with this one device that, that fits into the pocket. It actually fits into my, jeans pocket. So I don't need really the white coat, at all. And then on top of it, it's actually a really cool device, which, I love, because I've had the whole gamut of Android devices, including, the indestructible Unihertz Titan, which is, like the big boy Android phone. But the thing is, it is thick. It looks like something the U.S. military would use. And so it's, it's got its own coolness. But this is the first time, like everywhere I go, I get teenagers who come up to me. I get like the young people who run the Dunkin' Donuts, drive-through. Like every other time I drive through and I pay with my app here, they're like, "What is that?" Like like, what is that thing? so the coolness factor is definitely there, and there's just something delightful about using it in the course of delivering professional care, because why do we have to be stuck with clunky gear? We should be able to use stuff.
That's right. You should have the best stuff.
Can I just take you around to all my customers?
No, this is beautiful. This is beautiful.
Now, in terms of like the actual patient care, I will tell you, because it does not have the physical keyboard like my old BlackBerry did, like I can wipe this thing down with Sani wipes, and I do it, and it wipes down just fine. The screen's been fine, after hundreds of wipe downs. There's not a lot of vents and holes. Really the only hole is the USB port. And so that way, I don't worry about it getting wiped down. Now I know that the Duo 2 is IPF1, so at least it has some kind of water resistance. I know this is like a 0 water resistance, but it's been, for just wiping it down, it's been fine.
Oh, good. That's really good to know.
And how about the internal experience? Do you use it to chat, during the day with nurses, other doctors, or anything like that?
Not so much, Therese, because the app that the nurses use for voice over IP, we use Volt, VOALTE, and they use it as an iPhone app. And so, so for ambulatory doctors like me, like we don't really chat with the nurses per se. We do use Imprivata Cortex as our secure messaging app, and so that gives you something of a kind of an SMS type of experience. I'll be honest, what I mostly use it for is personal communication, and so that's where, you know, I'm just constantly texting my kids and my wife and, you know, my administrative assistants and that kind of thing. I love how Teams runs well on this device, and so, you know, in my operations, it's a lot of collaboration on Teams. In fact, there are some Android features of Teams that are better than the you know, the desktop version, or I can imagine what it is that some of the release cycles are a little bit earlier on Android even than they are on the desktop. So for instance, there was a time that you could individually respond to channel chats, you know, on the Android version before you could do it on the desktop Teams version. So that was really nice. But, you know, being able to run that. One other feature you're reminding me that I had shared with Val earlier is this should really be, you know, one of the standard setups for the Duo, is to set it up so that when you open Outlook, you automatically have your email on one screen and your calendar on the other.
On the other.
This is the boss.
Everything.
Exactly.
Right? Because everyone else in the world, like they're sitting there like they're looking at their email like, oh, I gotta set up this meeting, but then they gotta go into the calendar app, right? So set up the meeting, and now they can't remember. Okay, what was that address? You know, what was the URL? You know, what was the date? But if you got both screens, you know, you never have that problem because you can see your calendar while you're setting up the meeting, you know, and vice versa. So this should be standard issue, is really set up one of the double icons so that it's got your calendar and your email, you know, with one click.
Because this is amazing, quite honestly.
Great.
Yeah.
Great.
You know,
you know, I feel so strongly that I want providers around the country to have a better experience than they are now. And people don't know what they don't know, you know, and you know, when people see it, they have the same reaction that you do, which is, wow, like I didn't know I could do that, right?
You know, I have colleagues that are in the finance space. I have colleagues in the retail space, colleagues in a number of different spaces that are using it for different scenarios and different use cases. And one of the things that I've been looking for is to basically, you know, think about AI in healthcare, right? We talk about how do we optimize how people get things done, you know, the solutions around it. And, you know, if we forget about the device for half a second, this is a way for us to help you be more efficient with your patients, with, you know, as a provider, period.
Yeah.
You know, look at what it's going to do for the hospital if you were to get the number of the, you know, physicians involved in using these tools to be more effective, right? And this isn't even talking about what's coming with Duo 2, better camera, you know, the slot to be able to see, you know, the status, things of that nature. So.
Oh yeah, did you see that, Dr. Ting?
I did. I noticed that. So it's kind of like right on the edge, like a little mini display. Yeah.
Yes.
Yeah,
that's kind of cool.
Really cool. Yeah.
Yeah. And so I got a couple more questions for you, Dr. Ting. Is I think I noticed that you signed in with Haiku with your fingerprint. Was that right?
Yes. Yeah. So they're actually just about every app that allows fingerprint ID will use the Duo ID, and so you can just, you know, tap on the.
Yeah, that's wonderful. That's really cool. And lastly, can I ask you about the battery life? How do you feel?
Oh, it's wonderful. So so I understand with the new model, there's even a little bit bigger battery, but this goes literally all day. So I have been using it, you know, all day long in clinic, and I'm at 38%, and I have not plugged it in, and so typically it'll take me all the way through, you know, the end of a business day if I'm you know, doing video conferencing, you know, anything that's video will suck the battery pretty quickly. But if it's you know, looking stuff up, voice calls, and, you know, texting, surfing, you know, that kind of stuff, it pretty much goes all day. and then I just charge it up overnight.
Working with your colleagues, you've given us a great understanding of what you can do with it. What's going to resonate with other physicians that are doing the same type of work with, from you? Because again, some people get attached to the laptop, the tablet, the Mac, like what's the best way to reach them, especially when they're kind of used to doing things the old way?
That inside, we all have this desire to head toward a single device, right? Mm-hmm. The problem is 97% of doctors use iPhones. Mm-hmm. And so even if you convince them that this is the most awesome medical gadget, now they're still going to walk around with this and an iPhone. And they're going to wonder, well, why can't I do this on my iPhone? And they're going to wait for Apple to come up with a foldable phone, right. And they're going to say, oh, and I think that is, one of the pieces that needs to be figured out, because for 97% of doctors, they're going to now have to walk around with two devices. Mm-hmm. And I've had, conversations where I'll show the Surface Duo or the BlackBerry or anything, and they'll go, wow, I really like having the keyboard, but I can't imagine not having my dear iPhone with my iTunes and my, mm-hmm. I've got all my media files and now for me, like my whole kind of media life is on the Microsoft platform. So I'm like a totally OneDrive, like that's where all my photos are, all my videos, like everything is OneDrive. And so to me, having this device is great. Like I don't need the alternative. But Alfred, to your point, it's even different than for nurses, by the way, because nurses don't want to use their personal device. And we've seen this. Remember, Therese, when you asked, do the nurses chat, Yes, they actually have corporate provided iPhones, and they insist on using those devices when they're on duty and doing their voice over IP. And the reason is they don't want to go home with all the germs and viruses and all the crap that's, that they get exposed to. Now, you wonder why don't the doctors feel that? I don't know. Like the doctors prefer to use their own device. It's kind of weird that way. So I almost wonder if there's a potential larger market to look at nursing, because they tend to want corporate provided devices. Right?
Dr. Ting, along those lines, how do you feel about home healthcare providers? Having this fit in that space, because that's where we've had conversations with other organizations where that form factor really starts to come into play, where they're taking just a single device that's corporate bought, right?
That's exactly it, Thomas. So single device, you can stick it in your pocket, or in your scrub pocket, but yet it unfolds into a full tablet. And then you add in the stylus, so now you can really, sign things, diagram, get into the small menus. Very much. And the fact that increasingly those folks are using the EHR, right? And the EHR is not optimized for mobile. The EHR, regardless of whether it's Epic, Cerner, Meditech, it's all, desktop and mouse focused. So that's why when I showed you guys, running this on Citrix and then using the stylus to kind of get in and simulate the mouse movements, that this is it's pretty magical to be able to do that. But Thomas, you're right. So home health, hospital at home. So there's going to be a lot more activity in the virtual care space, where we've got essentially mid-levels and non-clinical staff doing interventions with patients, and they're going to be working remotely, right? And so that's another opportunity.
Wow. What'd you think, Fallon? What a great content. That was really, amazing what Dr. Ting was doing with that device.
Yes, I mean, he clearly showed the versatility of it and how well it gets used. It's just not something simple, but very, very effective to everything that he used on a day-to-day. Getting 17 hours of video playback time on in using it, whether it's Teams conferencing, and just the talk time of 27 hours is very, very impressive. And that's why he said, it lasts him the whole day. And that's why it's his choice of device that he would definitely continue to use.
Yeah, I mean, I really love the fact that when he was using that device, we saw his level of excitement, his level of productivity went up. And you can see in our, conversation around why these devices matter, we see 70% of organizations will embrace this because it gives them that flexibility, that remote work style. We see leaders, business leaders, expect more than 50% plus of their workforce to remain remote and hybrid, right? Because that's what these tools do. And this will help them make those decisions around devices. The irony in this is he was only using a Surface Duo version 1. Imagine what he could do with the NFC reader, the 5G controls, as well as the 3-lens camera.
Right.
My biggest thing is I want to make sure that each one of you guys have a chance to check out some of these changes in technology. The beauty of this is that it's tied into your infrastructure. You're able to manage it through Office 365 or Microsoft 365, and you have what we consider enterprise level security. So you're still fully protecting the device, and you're taking advantage of technology that works harder on your behalf. That's what I love about this. So with that, I mean, what are some thoughts? What are the next steps? What would you expect people to do, Val, in terms of taking advantage of something like this?
Oh, you know what? You've got to get one in your hand so that you can truly see some of the features that, being able to do Teams on one side, being able to see patient information on the other side, turn it around vertically. You can extend your documents. It's true collaboration. It's just not exactly as what this picture shows. You can annotate. You can do some drawings and share information. You can have things read to you as well if you needed to. There's so much functionality. I'm super excited, Alfred. I'm lost for words.
No, I hear you. So I think, the beauty of it is think about what your role is today and within your organization, whether you're a healthcare provider, whether you're in the retail business, manufacturing business, ask yourself, even if you're a gamer, are there certain functionalities that you could benefit from something like this, where you're able to get more work done, stay more efficient, and also be able to use it in different form factors? And maybe talk to your IT administrator, maybe talk to somebody that helps with mobile device management, and encourage them to take a look at something like this. You'll be able to do a lot more on it in a smaller device, and the form factor isn't going anywhere. We're Microsoft. We like to innovate. We like to build new solutions. We like to challenge organizations to think differently about how they get work done. If you're sitting at home working today, and if you're working with patients, think about how this will change the way you do things. We'll continue to innovate on this. And right now, the latest version is Surface Duo 2. Take the time, check it out.
Right. So, and one last thing, Alfred, I do want to add is that, Microsoft, even though this is an Android platform, you can still manage it with Intune, So that's the beauty of it. It's just soup to nuts, everything that you would possibly want in a very powerful small device.
Exactly. So with that, I know we can talk about this all day. I really appreciate having the opportunity to hang out with Val and, get her feedback. And, what's one word you would describe the Surface Duo 2, you would use to describe the experience of the Surface Duo 2 so far, Val?
Game changing.
Yeah. And mine is exciting. I think yours is cooler than mine, but it's still kind of awesome, right? If you want that excitement, if you want that game-changing experience, check out the Surface Duo 2. My name is Alfred Ojukwu. I'm here to support you, and I'm here with
Val Fallon. Thank you so much for the time. This has been great.
Excellent. And we will see you guys next time. Thanks, guys.